हेलो एवरीबॉडी वेलकम टू वन डे वन सिस्टम कंप्लीट डिजीज सीरीज एंड आज हम बात करने वाले हैं रिप्रोडक्टिव सिस्टम के बारे में यानी कि जेनिटो यूरिनरी रिप्रोडक्टिव। यहाँ पर वी आर गोइंग टू टॉक अबाउट एनाटॉमी फिजियोलॉजी पैथोफिजियोलॉजी बायोमार्कर्स डायग्नोसिस थेराप्यूटिक्स एवरीथिंग. So we all know that male and female reproductive systems are different, and there is a formation of sperm in the male, which is a male gamete, and ovum in the female, which is a female gamete, by the spermatogenesis and oogenesis process. So काफी बार यही जब नहीं बन पाता सही से, right? So a person remains infertile, or there's premature ejaculation, erectile dysfunction, a lot of different problems जब आपका blood flow भी इस organs को affect करे. Similarly, mostly इनके regulation होते हैं up to fertilization, conceiving, hormonal regulation, and in females the gestation. Male reproductive system की मैं बात करूँ, so you have testis, scrotum, epididymis, vas efferents, vas deferens, penis, which is the main copulatory organ, and some glands like seminal vesicle gland, prostate gland, bulbourethral glands that secretes fluid that nourishes the sperms. Sertoli cells nourishes interstitial Leydig cells, produces testosterone. Similarly, in the females, you can find that there are a lot of different internal and external genitalia organs. You have labia majora, labia minora, mons pubis, clitoris, correct? Cervix, vagina, uterus, a lot of different organs. So the hormonal symphony, these are controlled by the HPG, hypothalamus pituitary gonadal axis. This is through the feedback loop. Through the negative feedback mechanism, testosterone LH stimulates the testosterone secretion. FHS will stimulate the sperm production. Simultaneously, ovaries will be triggering the ovulation, and FSH will stimulate the follicular growth. Right? So LH will trigger the progesterone secretion, while the FSH will promote the estrogen secretion. But during the menstrual cycle, 1 to 4 days is the menstrual or the proliferative menstrual phase, followed by the 5 to 13 days, which is proliferative follicular phase. On the 14th day, there is ovulation, and from the 15th to 28th, there is luteal or secretory phase, which goes on. So there are different degeneration. There's formation of Graafian follicle, primary oocyte, secondary oocyte, tertiary oocyte. A lot of different follicles which can be formed. So the baby is very, very important. The labor induction. Sometimes there is sometimes there is surrogacy. Sometimes there's a test tube baby, which is in vitro fertilization. Sometimes there is miscarriage. So this miscarriage is also of multiple types. One, when the failure of the baby to descend through the cervix, through the uterus, in through the vagina. Sometimes there is, teratogenic agents which are acting on it and just disrupting it. There are a lot of different things that are affecting it. Similarly, male pathophysiology, we have benign prostate hyperplasia, prostate cancer, infertility, and erectile dysfunction. Okay. Erectile dysfunction, benign prostate hyperplasia, prostate cancer, and infertility. So, in the infertility, there can be variocele, and you'll need a hormone replacement therapy, in that case, androgen replacement therapies. For the erectile dysfunction, the phosphodiesterase inhibitor, tadalafil, sildenafil, vardenafil, will promote the blood flow that will lead to a hard penis. BPH, mein there are alpha blockers, tamsulosin, prazosin, in which the prostate enlargement causes an obstruction. So, this prostate enlargement needs to be controlled. And prostate cancer, where we have prostate specific antigen, which is used to detect, and biopsy can be estimated. In the female, there are a lot of conditions like the PCOS, polycystic ovarian syndrome. It is treated with metformin nowadays. Then we have tissue damage, in which is this endometriosis, ectopic pregnancy, and then there are fibroids or cancers. There could also be some viruses like the malignancy HPV virus. So the laboratory analysis, we can perform the testosterone, progesterone, estrogen, sperm motility, sperm count, semen analysis, FSH, LH. For the imaging, we can do ultrasound of ovaries, uterus, MRI of the soft tissues, or we can take out pap smear for the cervical cancer screening. So disease, sometimes there are pharmacological and non-pharmacological factors which are used to modulate. So pharmacological may the hormonal agents, the drugs acting on the modulators, estrogen modulators, down regulators, aromatase inhibitors, or we have a lot of testosterone agents like 5-reductase inhibitors and all. So in the male, the removal of the vas efferents is vasectomy, variocele repair for the fertility, or the TERP, which is a prostate resection for benign prostate hyperplasia. In females, hysterectomy, removal of uterus, oophorectomy, removal of ovaries, cystectomy, removal of cyst, or myectomy, removal of the fibroids. And there's mammography and a lot of terminologies in case of the breast cancer. Similarly, in the oncology, you have radical surgery that is useful for the excision of the cancerous tissue, and the art therapy, that is the hormonal replacement therapy and androgen replacement therapy and the estrogen replacement therapy. So that is it for today's video. Thank you so much, everybody. I hope that this series of one day, one disease, one system has helped you a lot. Today is the last day of this series, and I hope all the 12 systems are clear to you, right from gastrointestinal, digestive, urinary, renal, pulmonary, hepatic, lymphatic, endocrine, and the cancer. Thank you so much. Stay connected with us for more such upcoming informative videos.